It's never easy as a GP to look after a person who has been involved in violent crime.
This is my main concern. I mean, if they're just going to leave it like that, which I'm hoping they're not, because I can't stand the sight of it.
Delivering difficult news to patients is never easy, and I don't think it ever becomes easier. Just to be clear, this clinic would be a clinic for people who we suspect may have a potential cancer, OK?
Forming a good relationship with your patients is one of the cornerstones of good general practice.
The sooner you can give birth to this and get this out,
That's
the
muscle.
better. That's muscle, is it really?
Most people have six-pack. I
Yeah.
have a barrel.
And I feel such a brat. You say I've got gout, and everybody thinks that's funny.
Barnum Surgery has been to Pam. How can I help?
Hello, good morning. Thanks for waiting.
Thank you.
Hello, Sandra. My name is Dr. Bajwala. How can I help you?
On Tuesday,
Oh, my
I
goodness.
was on a trip and a wasp stung me in my eye, like just under my eye. And
Yes.
instead of getting better, it's getting worse and worse.
Yes.
Ambulance came, but
All right, okay.
they just gave me paracetamol and stuff, and that was it.
When was that?
Tuesday
So
Tuesday
that
night.
you had a sting by the bee, is it?
Yeah, it was.
And after that, you were swollen like this?
Yeah,
Straight away?
yeah. And
Yeah.
it's just getting worse and worse. Like yesterday, I could open my eye, but now I can barely open it.
Yeah. What I want to do, I want to take a temperature. I want to look into your eye and obviously feel that place, and we take it from there.
Yeah, it's really numb.
Yes. Okay. So where did you go?
Newlands Park.
It's nice, isn't it? Yeah. So I can see there is a bit of... Does it hurt when I touch?
Yeah, just a bit like around
Okay.
here.
Yeah. So, obviously the place where it has stung, there's too much space in it. So that's why a lot of fluid get collected in it very quickly. Obviously the ibuprofen you're taking, which you take 2 tablets 3 or 4 times a day, you need to continue with that. Antihistamine, you're going to continue with that. But I'm just wondering if there is any infection, I should give you some antibiotics as well.
Just only she's allergic for penicillin.
I wouldn't give penicillin then.
Yeah.
Obviously, if you start having high-grade fever, persistent vomiting, then you need to go to A&E. Yeah? Okay? We call it cellulitis then. Then it's something different and you need something in your veins. Yeah? All right?
All right, thank
It was
you.
nice meeting you and good luck.
Yeah.
Yeah. Yeah.
I'm going this way, Alison, whilst you fight with the wasp.
Alison, you're going to really annoy him.
He's all right.
Well, it's very difficult to concentrate on consultation with him in here. Oh, God. Come through. How are you? Appointments for him?
Yes, not bad.
Good. All right, so how can I help?
He was sweating a lot in bed.
Yeah.
And in mornings, his pajamas was basically soaking wet.
Yeah.
And he had a bit of a cold on him and cough on him.
Yeah, I always have coughs now. And my mummy has bleeds.
X-rays.
Yeah. How long has all this been going on for?
Sweating been over 2 weeks. Coughing is
You
bad.
should take
Been
your
a
jacket
month.
off. It's not raining.
Okay, Dorian, darling.
All right, let's have a look at him, and then we'll talk about the X-ray, and then we'll decide what we're going to do. Dorian, let's have a look at you, darling. All right.
What's that?
What is this?
Yeah.
It's a torch.
for your ears.
Yeah, your ears and your throat. So say ah for me. Big ah, show me your tongue. I can't hear you. Say ah. Good boy. Oh, is he bringing anything up with the cough?
Yeah.
Okay.
Do you see any water in there today or not?
Do I see any water? No. Can I see anything growing?
But when I drink
No.
water, it makes the sound in, but the water goes in my ear, but it goes all the way down.
Does it?
Yeah.
So when you drink water, it goes in your ears?
Yeah, fan, it goes all the way down
Wow.
to my mouth.
Wow, that doesn't sound right. Okay, can we have a listen to your chest here?
Yeah.
Okay, good boy. Some deep breaths. Okay. And
About
turn around
my
here
back?
for me. Oh, yeah, I'm coming onto it. I'm coming onto it. Come on. All right, and again. Keep your mouth open, darling. Okay. All right. What the chest X-ray shows is that actually just in some of his airways, they just look a bit thicker, and that can sometimes happen when you've got build-up of mucus in the lungs and the airways. So it may be that he's just harbouring an infection, but because it's gone on for so long and he's been having the night sweats, it's probably best treating him with some antibiotics to see if it settles it down and clears up the congestion that's inside. So are you okay for him to have some antibiotics?
Yeah.
Yeah. Is he allergic to anything?
No.
This is your medicine, Dorian.
I hope it's going to be okay.
Yeah, let's see. If afterwards things aren't settling down, then come back and see us. Okay.
Sticky things on my shoe, look.
Yeah, you do. Oh.
Yeah.
Okay. So you've stepped in something mucky.
Enough one, let me check. Nope.
The
Only a little bit.
The mum had to clean your shoes.
Here.
Thanks, Abby.
All right,
Yes. So thank you to the doctor.
Thank you.
You're welcome, Dorian.
Good boy.
Do you know, after my lunch, I'm going to go to the police station.
You're going to the police station? What? Have you been a naughty boy?
No, but just playing with the police station mans and ladies.
Oh, okay. All right, you make sure you have fun then, okay?
Yeah.
All right, bye-bye.
Where is he? Damien. Hello, mate. I couldn't see you there.
Sorry, buddy.
I didn't recognise you because of this all nice shaved head at the back here.
Got a bit close to it.
Yeah. I think you did. Come and take a seat, mate. How are you getting on?
Well, so really. I'm still getting in a lot of trouble with it. It keeps swelling up. I just can't physically do the things that I really want to do, and it's frustrating the hell out of me now.
Yeah, I'm sure it is.
It's driving me mad. Like today, I was kneeling down,
Yeah.
and I went to stand up to walk off, and it was just complete agony. I had to stop for about 5-10 minutes. It feels like I'm being electrocuted and burnt at the same time.
That's your nerve
That's
damage.
all the nerve damage, yeah.
Damien was the victim of quite a nasty assault about 10 months ago. He was set upon by a large number of people outside of a pub in which his leg was broken, both his tibia and his fibula, then came through the skin, causing a very nasty wound. The base of his leg was held on only by some of the soft tissue that was left. Well, I think a couple of things as well. So don't forget that you've actually lost muscle bulk on here.
Yeah, from here, round there. I mean, because this bit's still stuck to the bone. I don't know what they're going to do about that.
Looks like, you've had a shark attack.
Yeah, I thought someone's taking a chunk out of it. Yeah. I shouldn't really be so bothered about it, but it does wind me up with people just staring at it, you know, when you're out, and it's just completely... Oh, it's driving me up the wall.
I just find it very painful.
The only solution to this is surgery, is an operation.
They sent me to London.
Right.
And he said he can't do the operation.
Because?
There's a good chance that I won't survive on the table.
The purpose of the pre-op is to make sure that, baby's fit enough to have the surgeries. It's pretty scary stuff. Yeah, I can imagine.
Should I give that to you or to the boss? There you go.
You're on some sertraline at one stage. Are you still taking that, or...?
Well, yeah, I am, yeah. I need to get some
Do you
more
want to get some more of those? Because you're probably just about run out in any case, yeah?
Yeah. And I need you to do me another note if you can.
Yeah. Well, I'm happy to. What were you doing work-wise before this?
I was mobile mechanic.
Yeah.
And I just can't do it. I've got the job centre breathing down my neck, obviously trying to force me into work.
Yeah, they will.
And I've tried explaining to them that it's not a case that I don't want to go to work.
Yeah.
I do want to go to work. It's just that I can't do my job.
Damien ended up having two operations. The first one was to take away all of the mangled tissue and the dead tissue, to clean up the bones and insert a very large metal rod all the way through his tibia, his main bone in the leg. 2 days after that, the plastic surgeons took over. So I believe the idea is to try and even it up, to hopefully take away some of the pain and to make it cosmetically a lot better to look at. This is where you need to go in with all your questions.
Yeah.
Write them all down and say...
Well, that's just my main concern. I mean, if they're just going to leave it like that, which I'm hoping they're not, because I can't stand the sight of it,
that doesn't seem to be the case there. It looks to me as if they're looking at flap revision and to redo some of that.
Yes, it is getting rather frustrating. It's got a lot better though. Honestly, it's got a lot better.
Well, it has, and you know, you're lucky to still be walking. To be fair,
yeah.
Or walking with two legs.
Yeah.
So you know. There you go, buddy.
Thank you.
Okay, mate. Let's see how we get on. Yeah.
Yeah.
So yeah.
Okay.
Okay, mate.
Lovely.
See you later, buddy. You take care, mate. Yeah. Bye bye.
I got a couple of bottles of wine on Saturday, so I drank one Saturday night, and by 8 o'clock I was in bed doing the snooze. So
You're wild.
So yesterday I was like, no, I'm not going to have a drink. No, I'm not going to have a drink. Well, I'll just have one.
Oh, yeah.
Yeah. But I did stay up till gone nap because I was watching Deadpool. I know, my weekend, I'm just getting more crazy.
What weekend you had.
I know.
Hi, come on in. Nice to see you. I'm Dr. Tawana. How are you? You're not feeling too well? OK. I'll have a look at this in a minute. Tell me what's been happening.
So about a week ago, I woke up and started feeling some tightness around this whole, there was a band across. And then a few days later, I started feeling more sharper pains around here. And then also began feeling short of breath sometimes.
Yes.
So I could be just sitting and then all of a sudden I'd be out of breath.
Yes.
Or I'd feel like a shock.
Like a sharp pain?
Yeah.
So it catches you suddenly?
Yeah.
So movement, maybe?
Yeah, sometimes movement, sometimes staying still.
Yeah.
Sometimes just breathing, it hurts.
Sure. Any pain in your calf muscles of the legs? Yeah?
Yeah, when I stretch them out, they sometimes lock up.
Yeah.
Very painful.
And is it both sides?
Mainly left.
Mainly your left. OK, all right. Now, can I have a listen to your heart and then we'll listen to your lungs?
Okay.
Let's have a listen just here. Pop that down there. Take a big breath in for me.
As you walk through there, Cindy, and all your hair was all like a little bit babe station.
Photo shooting for babes.
Yeah.
Go on, Cindy. I can't do it. I ain't got any.
Oh, God.
You'll have to shake something else.
Oh, God, no. Knock myself out.
You give yourself a black eye.
I know I would.
Yes, please.
Bill. Yes, still running bikes. I've got a young doctor with me. Is that OK? You coming in? Yeah. This is Dr. Shah.
Hey, try.
We haven't had this row for a couple of years now.
It's Butch Maxi.
It's not even a full-face helmet.
It's hot out there. I've got to be able to breathe in the air. It helps me oxygen.
Should we talk about Graham? Who nearly died?
Yeah.
On a motorbike?
Yeah.
Bill is one of the reasons I love being a GP. I've looked after Bill and his family for the 17 and a half years that I've been a GP. It's been a real pleasure and a privilege. I'm genuinely concerned that Bill is still riding a motorbike, probably because Bill's own son, Graham, was seriously injured in a motorbike accident a few years ago and is still left with the consequences of that motorbike accident. Anyway, how lovely to see you.
Yes, thanks, Dr. Morris.
Right, that is the readings.
So check his blood pressure. Yeah. Okay, come on, have a. Yeah. Okay, so what do you think of those readings?
They're not too bad,
Yeah.
actually.
Yeah, you see 140 over 105. Because I wind you up and you know. So are we going to go with the home readings or the surgery readings? The home readings, that's okay. We encourage patients to do their own blood pressure readings because we've got plenty of evidence now that blood pressure readings taken at home are lower than in the surgery. Also, it encourages patients to take an interest in their blood pressure. So it's all about, I think, informing patients and empowering them to take interest and responsibility for their own health. So we're going to carry on with the medication as it is, and we're just going to say that that is, you know...
I'd like to live a little bit longer.
You and me both. About you. Yeah. Obviously, the sooner you can give birth to this and get this out, the
muscle.
better. That's muscle, is it really?
Most people have six-pack. I have a barrel.
You have a barrel? Yeah.
That's why the girdle's there.
Is that right? Yeah, to hold it. Yes, I didn't. Yes. See how much better your back would be if you weren't carrying around a 9-month-old.
It's solid.
It is solid. It's solid fat.
No. Fat wobbles when you run. I can't even run, but there you go.
Men tend to have what we call apple obesity, which is when they have most of their fat around the abdomen. And ladies are said to have pear-shaped obesity, where they have most of their fat at the tops of their legs and on their buttocks. Bill clearly has central obesity. And the fat that you can see is also around his liver and his heart.
On the fitness programme, I ride more. Well, if I'm riding, I'm not eating, see, that's why I...
OK, yeah.
So, like...
It's called false logic, that, but yeah.
So, have you done with me?
Yes, thank you. It's nice to see you.
Yeah, appreciate that.
Yeah. Thanks for telling me what to do.
Yes, I'll...
And I think your blood pressure, if you can check it a couple of times a month, will be fine, really.
Yeah. Right, awesome.
OK.
It's nice to meet you.
Nice to meet you too.
Yeah, right, yeah.
Cheers, Bill. Take care. Thanks, Joey. Bye-bye.
Bye-bye.
Someone shoved chewing gum. Please don't let that be chewing gum under that desk, because if it is, I think I might cry. What? I swear that better be blue tack.
Where?
Turn into a bit of a germaphobe working in a doctor's, didn't you?
Take a big breath in for me, and then out. And now hold your breath. Fantastic. Do you mind if I press on the middle of your chest there? Please tell me if it hurts. That's uncomfortable, is it? OK. That's hurting there as well, isn't it? OK, fine. Can I get you to do this? Stand up for me. What we're going to do now is, can I get you to pop your hands behind your head and then turn one way and then the other? And when you do that, does that bring the pain on? Yeah? Yeah. And what about hands down here? And we get you to do the same again. So turning left and right. No. No, but you felt it certainly when you did that one. OK, take a seat again. OK. I think I know what's going on. And thankfully, it's not serious. What we have here is our rib cage, OK? And the bone in the middle is called the sternal bone. Either side of that, where the ribs come off, you've got some cartilage joining the bones all up together. And if we've had, for example, a viral type of infection, sometimes that virus irritates in this area and it causes a condition we called costochondritis, which means there's a bit of irritation and inflammation going on here, which is why you've been feeling the way you have. So how we treat this, let's just have a look. Are you OK taking medicine like ibuprofen? Yeah. The reason I ask about medicine like ibuprofen, it is the best medicine to try and settle the irritation and the inflammation going on here, as well as giving you some paracetamol or recommending you take some paracetamol. So if I prescribe you those bits, we'll get you to take them over the next 3 to 5 days. I'm pretty confident that that's going to take the edge off things and help settle this down.
Okay.
You start taking this medicine and you feel worse, then please come and see us. All right. Okay, there you go, Said. Take care of yourself. Get well soon.
Thanks.
Okay.
Thank you.
Oh, you're welcome. Take care.
I've come to make a prescription.
Yeah.
Joseph Kirklu, Kurklu.
Is it in there, is it?
Yeah, I think this is one I brought down earlier.
It should have just been done by the doctor a few minutes ago.
Do you want the prescription? Will it be in there? Oh, right.
Is it a prescription, sir? If you can just do us a favour.
Yeah.
Can you go up to room 17 and see if there's a prescription ready?
Hello. Hi. Please come and have a seat, Dr. Bolger. Just let me get your notes up. Dr. Allen's patient, yeah? Yes. And how can I help this evening?
I think I've had a blood clot.
Where?
My leg.
Right, OK. And have you been to see anyone?
No, you're my first.
Right, OK. Let me have a look. Oh, right. You've got some bruising, yeah?
Came across really warm yesterday, severe pain, and then...
And then that appeared?
Then that appeared.
Right, I need to examine you properly. I need those off, I'm afraid. Is it still painful?
Yeah, very.
Right, OK.
I have had PE before, but I was pregnant, so I sort of know what it was like from last time.
Right, OK. So is the leg swollen?
Only in that place.
Just around that vein, yeah?
Yeah.
So hopefully it's vein rather than arterial.
Parliament Surgery Scheme to Pam, how can I help?
OK, can you lie down for me? Nothing down in the calves?
No, but I had one on here a couple of weeks ago that went.
OK, so that you're bruising more easily, yeah?
Yeah.
OK. So this came on yesterday, yeah?
Yeah.
And you're not on warfarin or anything like that now?
From the point of view of risks, the main issue with a clot is where it is in the body. So a clot in the vein in the leg will cause symptoms. It causes quite a lot of pain and discomfort, but it's not dangerous from the point of view of where it is in the leg. It's dangerous in that it can break off and cause problems in the lung. A clot in a blood vessel in the lung or a clot in the vessels that supply heart tissue can be very, very much more serious.
That's really sore.
Very tender, isn't it? So that looks like a superficial thrombophlebitis, yeah? Which is where one of the smaller vessels gets blocked and it gets tender and inflamed and a bit warm around it, yeah? There's nothing in the thigh itself. There's no redness there that I can see. Was this red yesterday? Because it's not now. It's not been red at all.
No, it really itched afterwards.
Did it?
Right. Really strange. It just really itched.
So I don't know if you remember from when you had your clot in your leg, or was it just in your lung?
Lung.
Right, so you never had anything in your leg. OK. So what you would expect is you'd expect swelling, you'd expect redness. There's no swelling, there's no redness. You would expect it to be tender, and it is, but just over that localised bit there. So hopefully this is something superficial, yeah? Rather than something systemic.
Yeah.
You said you had another one. Where's that?
So that was on here.
So you've been popping them, have you?
I reckon, yeah. So I have B12 every 8 weeks, and that tends to... So if I don't have it frequently...
You bruise more easily then?
I bruise more easily.
And your B12 is up to date?
Yes.
Then we should check your full blood count, OK? Check your platelets, check there's nothing going on. Does that make sense as a plan? Come back across. If it continues to settle down, then obviously that's fine. But any suggestion it's moving the other way, you call straight away.
Carry on. I'm OK working.
Yeah, you're fine. What do you do?
Yeah, I'm facilities manager, so...
Yeah, that's absolutely fine. That's better than sitting around, yeah?
All
Keeping mobile, yeah?
Yeah.
Can you come in tomorrow morning for a blood test? Tomorrow morning? OK. Now, the result will come back to me. If there's any issue with the result, I'll be in touch with you. I'm going to check your blood count and I'm going to check your clotting, yeah?
OK.
If it is all fine and it settles with some pain relief, and we don't find any underlying cause, then you just monitor. But with this leg, if there's any suggestion it's moving the other way, you're getting any swelling, any redness, anything that suggests there's something going on deeper, we need to see you. Okay?
Yeah, brilliant.
Yeah, keep a close eye for us, yeah?
Yeah, we'll do.
Good.
Thank you.
Bye-bye.
Any stress at work at the moment?
No, really. They are very cooperative, honestly.
They are,
They are looking after
Remind me what you do for a job, sorry.
I'm doing retail Marks and Spencer.
It's gone right across the back of my neck.
Yes.
And it's affecting me driving.
Yes.
I just don't know what it is.
What do you do work-wise?
I'm a mechanic, so I do quite a bit of heavy lifting.
Where do you work?
Right, Heathrow.
What do you do?
We clean aircraft, like, yeah?
Oh, yeah. My husband works at Terminal 5.
Melissa Lambert.
Hiya. Hello. Right, so I've come in, basically. I got discharged from Frimley 2 days ago for quite a nasty infection that I had. And just leading up to that, I've just had loads of illnesses, like one after the other, for the last 5 months. And didn't know if there's anything else going on, whether there's some vitamin deficiency or something with the immune system. So I'm a bit just concerned with it, really. Got quite ill and had to be admitted overnight this week.
So what was the infection?
Tonsillitis.
Okay.
And then, so it's the second time I've had it.
Okay.
It's just that every single month I've had something going on, whether it's kind of chesty, usually throat related, but then with high temperatures and everything else, and just feeling run down all the time, to be honest. And yeah, I don't really know.
Is there any reason why you should be run down or short of vitamins?
No, not really. I've never had any problems. So all the other kind of previous years, I maybe get one thing a year, and I've had about 5 in 5 months. Like every single month, I seem to just pick up something, and nothing's really changed. So
You're not in a new job?
no, I work in a hospital.
You're full of sick people. You're bound to catch things.
Exactly. Yeah. Well, it's not changed. No, no, nothing seems to have changed.
So what do you do in the hospital?
I'm a physio.
Okay. So I think we should do a chest X-ray.
Yeah.
I think we should do a full blood count, check your liver, your kidneys, check you for diabetes, check your thyroid, check your vitamin B12 and folate and your iron levels, but not do a vitamin D because you're not dark-skinned. You've already had today's dose. So you know, it's unlikely. Really, vitamin D, anybody who's colour skin like you, is going to be low, so you need to have vitamin D supplements. And you and I need them in the winter.
Yeah.
Vitamin D deficiency and insufficiency is quite a hot topic at the moment. We know there isn't enough sunlight in the United Kingdom for patients with pigmented skin to make vitamin D pretty much throughout the year, really. So the advice is that patients with pigmented skin should think about having a vitamin D supplement every single day. I think fair-skinned people who get sufficient sunlight exposure during the April to September months, which is probably 20 minutes a day, don't need to take a vitamin D supplement during the summer, but that they should seriously think about having a vitamin D supplement every day on the October to March months. Okay.
Lovely, thank you
Okay,
very much.
hope you get better. Hope you come again.
Time. Yeah,
Okay.
fingers crossed.
Take care. Nice to meet you. Bye-bye.
Oh, I've got cramp in my foot. Well, take your shoe off and walk around.
And my feet are red, bright red, because I've got that lurgy.
Don't come near me. You can sod the allergy anywhere else, love, not me here.
It's not contagious.
How do you know?
Because I know.
No. Are you a nurse?
The doctor has told me. No, the doctor has told me it's not contagious.
Yeah. I don't believe you. You're going to pass your allergy on to everybody, aren't you? And
shall I go home then?
I said no. We'll go home and you sort it out.
Casper Massa, please. Hello there. Come in, come in. This is Casper. Grab a seat, Casper. Do you want to sit there? Right. What can we do for Casper? Is this a bit of a giveaway?
My hand hurts. Basically, the ball hit here, then it's starting to hurt here.
Right, okay.
It hurts.
It hurts there.
It's pain or?
Yeah, it's pain. Okay, you can see that's sort of swollen, can you?
Yeah.
And also, it's a little bit sort of bent here. Now, children, is that sore there? If I do that? Children's bones are very bendy. He may just have bent it or he may have a little crack in it, but I think given how swollen it is and that it's still sort of quite sore, I think we need to get it x-rayed.
Yeah.
So what I'm going to do is I will put the form for the x-ray on the system.
Mhm.
You can take them up to x-ray today, anytime now.
Okay.
They will x-ray it, and then if there's a problem with it, they will normally say, we need to put something on it, and they'll send you to A&E straight away then.
Mhm.
But it's quicker to do that than just say, go up to A&E.
Okay.
Does that sound sensible?
Yeah.
Okay.
Okay.
But I think he might have a little break in it or a crack. Or certainly he looks as if he might have bent it.
Uh-oh. I'm scared. Why?
No, you don't need to be scared.
There's nothing wrong. I should be scared, not you. I'm scared of you. Something's going to happen to you. Makes sense? No. No, it doesn't. And I know it does. Don't worry. Doesn't.
So if you go up to the x-ray department,
Mhm.
go up anytime now, the form is on their system.
Mm-hmm. So, Mummy, now we're going after this?
now we go.
Yeah. In the meantime, just get them up there, get it done. If it's still sore and there's nothing extra broken, paracetamol is probably a good thing to help with this.
Okay.
Okay. Right, young man?
Thank you very much.
You're very welcome.
Okay, thank you.
Okay, you're very welcome. Take care. Bye-bye.
Have a nice good day.
And thank you very much. Bye. Bye, Casper.
Bye. Bye.
I went home and had a massive lunch at 12 o'clock.
What do you eat?
The biggest tuna and egg salad you've ever seen in your life, and then 3 slices of cheese.
Tuna and egg
Yeah.
mixed together?
Yeah, but hard-boiled egg.
Ew.
It was nice. Are you bloody over that?
Egg and fish?
Yeah.
I suppose that's what
But
you eat
egg and
in
anchovy
Spain,
work.
isn't it?
Yeah, but egg and anchovy works. I love anchovies. They're those really salty small fish.
You're disgusting.
And then
Do you
today
like
we-
sardines?
I love fish.
Whitebait is just dirty.
Yeah, but whitebait you just deep fry it straight away.
Is that what they deep fry and like put into chunks?
They'll either put it in. No, whitebait's tiny, so I mean you can eat the bones. They're so soft. Just
Oh. I think they do those in Bella Italia.
Probably. Whitebait.
Mr. McGarvin? Hi, how are you?
Yeah.
You all right?
You don't need it.
Let's have a chat.
Okay.
Yeah? You getting on with the new medication, okay?
Yeah, Viptomet. Yeah.
Yep.
Yes.
Good. Okay. So if you remember, we mentioned because you were found to be anemic.
Yeah.
We wanted to kind of check if you were deficient in iron, most importantly, and you are.
Okay.
Yeah. The other test we did do was your prostate test, which was normal, was within normal range. So that's reassuring, but we need to talk about this iron.
Okay.
Because in men, iron deficiency causing anemia is not really that common. And if it does exist, we usually want to investigate it to find out what's causing it.
Okay.
So there are lots of things that can cause anemia. If you have chronic conditions, like you've got diabetes and other things, sometimes that can make you anemic. Iron deficiency in men usually doesn't happen for natural reasons, as it would do, for example, in women when they have their monthly period. And so it usually means that there is an underlying disorder that perhaps we need to look for, whether that's a disorder such as inflammatory bowel disease or celiac disease, where they're not absorbing the iron, right through to more worrying causes. The iron deficiency bit sometimes makes us think of other things. Sometimes, for example, in the bowel, you can have growths sometimes that can cause small bleeding that you could lose iron from.
Mm-hmm.
And that's one of the things that in my mind, I'm thinking we maybe need to look at and consider whether we need to refer you, actually.
Yeah, let's do it.
Yeah. One thing we sometimes do, and we often like to do when you get blood tests like this, is examine the back passage in the clinic today.
Okay.
Is that something you'd be happy for me to do?
Yeah.
Yeah? So what I'll do first is examine your tummy,
Yeah.
and then we'll examine the back passage as well. So you don't have to lower everything straight away. If you just show me your tummy first. Okay. Excuse my hands, they're very cold.
Yeah.
And is there any history of any bowel problems in the family, bowel cancer or anything like that? No. Okay, that's fine. If you just lower your bottom things, and I'd like you to roll over to face that wall and tuck your knees up into your chest for me. Okay, just take some nice deep breaths for me, okay? If it's too uncomfortable, you just tell me to stop. You'll feel a bit cold. Okay, I'm all done. So, examining your back passage, everything feels normal. I can't feel any lumps or bumps or anything there that feels concerning. But like I said, I think we need to do some more investigations. What I think that should be is a referral to a clinic in the hospital and make sure that there's nothing that could be causing this anemia. Okay? So, just to be clear, this clinic would be a clinic for people who we suspect may have a potential cancer. Okay?
So it's this one here.
Yeah.
Okay, I'll show you how you use it. Perfect.
Okay.
Daniel Bridger, please.
You two, by the way.
Hello.
Hello.
Come and have a seat. So you're here for your asthma review today, Daniel?
Yes,
Yeah. Any problems?
I still get a bit wheezy every now and then. It's not too bad. I do get out of breath sometimes. Like I don't know why. It's just random. But I always like to have my blue inhaler there. Just
Good.
sort of. I usually do it before I go to bed because it sort of helps me relax almost.
So how often are you using your Ventolin then, do you think?
Like once a day.
Once a day?
Yeah.
Okay. So that would be seen to be using it quite a lot then. So if you're using something to relieve symptoms of asthma more than 3 times a week, then really you should be on a steroid inhaler.
Right.
Okay. So
I don't know. I don't think I need it.
you don't think you need the steroid?
No, I don't really want it. Really, I just don't like. It's been on them since I was a kid, so it's just like trying to work my way off that. You know?
Let's just do your peak flow and just see what that's like.
Yeah.
Big breath in and then just blow out really hard and fast. Oh, that's good. Okay, it's about 470.
Is that good or bad?
Your predicted peak flow is 560.
Right.
Okay, so it's a little bit lower than it should be. With asthma, what you get is symptoms of airway inflammation.
Yeah.
Then the only way of treating that is with the steroid inhaler. Okay.
Yeah.
Now, also, I'm going to give you one of these. Okay.
Oh, kids have.
Yeah, simply because if you're using this in the mouth, okay, even if you've got the best technique, okay, you only get 8% of the medication.
Okay.
If you use this through here,
Yeah.
you get 80% of the medication. Okay. So use your brown inhaler through this.
Yeah.
And I can understand as a young man when you're out and about, you don't want to carry this with you, but make sure you take your blue inhaler with you. Okay. And do you smoke, Daniel?
Occasionally.
Occasionally. How occasional do you smoke?
No, more than I should.
Okay. You're not going to tell me?
No.
Right, so you...
I'm trying to quit.
Yeah, good. Right, OK. Well, it's good that you're thinking about it and trying to cut down, so that's good.
I've got the patches at home ready to start when I'm ready.
All right, so you just have to...
Hopefully Monday I'm motivated to start.
Good, lovely, that's fine then.
Cool.
All right, I'll just get this signed for you, so if you just want to wait...
here?
You can wait there if you want to wait in the... Yeah, just wait here and I'll get this signed.
I'm not sort of saying for any second that I think this is a highly likely thing, okay? But I think it's something that we need to at least rule out. If you have the test, they find nothing else there, then at least that's reassuring. And then we need to find another reason, potentially, why you're iron deficient, okay? Normally, they see you within 2 weeks. So it's quite a rapid access thing. They'd normally let you know in about a week's time. And then they normally fact through the results. Once they've seen you, once they've done the tests, they normally let us know. And then again, we're seeing you regularly anyway, so we can catch up on things. And obviously, if any questions arise in the meantime, then always just pick up the phone and leave a message for me. I'll call you back before you see them. Is that all right?
Yeah.
Okay, and we'll catch up again in about 3 weeks' time.
Yeah.
All right.
Okay, thanks a lot.
Take care.
Great. You got a new den again.
I know. They keep switching me around. How you doing? You all right?
Yes, thank you, love.
What can I do for you?
I'm struggling with this gout.
Are you? So the allopurinol not helping?
Do you know what?
Or are you not taking?
I am fed up with cherries,
Yeah.
cherry tablets, cherries, you name it. The only thing I haven't gone on to is celery yet.
Okay.
And that's the other one that's good for it.
Okay.
The blood pressure was good.
Everything was good.
Was it?
Blood pressure's really good. 123/75.
So I've got another year or so then.
I think you've got a bit more than that. Let's just have a look at the allopurinol. I think we can up the dose of it.
I could hardly walk.
Okay.
And I feel such a prat. Walking, you know, they say, what's up here? And you say, I've got gout. And everybody thinks that's funny.
Why is it funny?
Well, it's an old wife's tale, isn't it? You only got gout if you drank port. Have you not heard that?
Yeah. We will need to keep an eye on your kidney function with this. I don't think we can increase it while you're on it. I don't want to put your allopurinol on repeat, to be honest.
But it is on repeat.
Yeah, it's on repeat, but I don't want to put it on... I don't want to give you 6 months of it, because I do want to see what your kidney function's doing.
Does it affect it?
Can do.
Should I carry on eating cherries?
Yeah, definitely.
Thank you kindly.
No problem. Take care.
Thank you for your time. Look after yourself.
Yeah, no problem.
Thanks for your time.
You too.
Thanks, Abby. All right. What's a good feeling?
See you later.
Yeah.
Bye-bye. Okay, bye-bye.
Thanks very much.
Nice to see you. You take care, okay?
Bye-bye for now.